All right, let's dive in. We're about to go on a tour of a place you see every single day, but probably don't know all that well, your own head and neck. Think of it like a map that tells the story of your health. You just need to know how to read it. So let's start decoding that map.
Have you ever really thought about this? You go in for a dental exam, and the first thing they do is start gently pressing on your neck and jaw. Why? Well, it's because the outside of your head and neck is like a window to everything that's happening on the inside. And today, we're going to learn how to look through that window.
So here's our game plan. First, we've got to learn the language, right? The secret lingo of anatomy, so we're all on the same page. Then we'll do a grand tour of the outside of your head, we'll venture into the mouth and explore the neck. And then we'll wrap it all up by connecting the dots on why this stuff actually matters for your health. Okay, before any great adventure, you need a map and a key to read it. In anatomy, that key is a shared language. It lets everyone describe the exact same spot, no matter if you're standing up, sitting down, or doing a handstand. So, let's learn the lingo. This right here is our true north. It's called the anatomic position. Just picture yourself standing up straight, arms hanging at your sides, with your palms facing forward. That's it. It's the universal reference point, the starting line for describing anything on the human body. So, to really understand the body in 3D, anatomists imagine slicing it with these invisible sheets of glass. The median plane, that splits you right down the middle into equal left and right halves. The frontal plane divides you into a front and a back half. And the horizontal plane, well, that just creates a top and bottom section. It's how we see how everything is related inside. Now that we have our map, we need a compass. And it's pretty simple. Anterior means front, posterior means back. So your nose is anterior to your ears. Makes sense. Superior means towards your head, inferior means towards your feet. Your head is superior to your shoulders. Easy enough. And the last two pairs to know, medial means closer to that midline we talked about, lateral is farther away from it, and then there's superficial, which is near the surface, like your skin, while deep is, further inside, like your bones. See? You've got it. Now let's put this language to use.
All right, let's do this. Our tour officially begins now. We're starting with the regions of the head, all the landmarks you can see and feel right now. We're going to start at the top and work our way down.
So first up is the frontal region. Yep, your forehead. Go ahead and touch that smooth spot right between your eyebrows. In anatomy, that's called the glabella. Now move your fingers up to the widest, most prominent part of your forehead on either side. That's the frontal eminence. These are key reference points for health professionals.
Okay, next up is the orbital region, which is basically your eye socket and everything in it. You've got the sclera, which is the white part of your eye, the iris, that's the colorful part that makes your eyes unique, and right in the center, that black dot isn't just a dot. The pupil is a super dynamic window into what's going on in your body. And that pupil tells a really fascinating story. It's doing a lot more than just reacting to light. See, it's wired directly into your nervous system. That's why certain substances have such a visible effect. Opioids kick on the rest and digest system, making pupils tiny. But stimulants like cocaine fire up the fight or flight response, making them huge. It's a powerful and totally involuntary clue. Ever had pink eye? Well, that's a perfect example of anatomy in action. That redness and irritation is conjunctivitis, which is just a fancy way of saying inflammation of the conjunctiva. And the conjunctiva is that super thin, delicate membrane that covers your eyeball and lines your eyelids. The name of the condition literally tells you exactly where the problem is. Moving on down the face, we get to the nasal region. You can feel the bridge of your nose, right? And that wing-like cartilage on either side of your nostrils is called the ala. Just below that, you have the oral region, framed by the lips. And that distinct line where your lip color meets your regular skin, that has a name, the vermilion border.
Okay, our tour is now heading past the lips and into the oral cavity. This is a seriously complex space with its own geography, and it's crucial for pretty much everything from talking to eating.
Once we're inside, we're going to zero in on four main areas. You've got the palate, which is the roof of your mouth, the tongue, obviously, the gingiva, which you probably just call your gums, and the floor of the mouth, which is right underneath your tongue. Go ahead and run your tongue along the roof of your mouth. You can feel the two different parts of the palate right away. Up front, it's bony and it's got ridges. That's the hard palate. But as you move toward the back, it gets all soft and fleshy. That's the soft palate. And that little punching bag thing dangling in the very back, that's your uvula.
Now, your tongue surface isn't actually smooth.
It's covered in these tiny little bumps called lingual papilla. Most of them are these thread-like ones, the filiform papilla, and they give your tongue texture to help grip food. But sprinkled among them are these little mushroom-shaped ones, the fungiform papilla, and those are the ones that have your taste buds.
All right, let's move down from the head to the neck. Now, the neck is so much more than just the stem holding your head up. It's this incredibly complex, vital passageway full of muscles, nerves, and blood vessels, connecting your brain to, well, the rest of your body.
Here's something you can try. Turn your head to one side and kind of clench your jaw. You should feel a big rope-like muscle pop out on the side of your neck. That's the sternocleidomastoid, or just SCM for short. Then, in the middle, you can feel the thyroid cartilage, the Adam's apple, and right above that, the hyoid bone. These are the major signposts of the neck.
And here's a really cool fact about that hyoid bone. It is the only bone in your entire body that doesn't connect directly to any other bone. Isn't that wild? It's just suspended there, held in place entirely by muscles, which lets it play this super important role in speaking and swallowing. It's a true anatomical marvel. So, we've done our tour, we learned the language, we've mapped out the major landmarks, but let's bring it all back to that very first question. Why does any of this matter for a health exam?
Well, a professional uses this knowledge in a very systematic way. They start with a visual inspection, just looking for anything that seems asymmetrical or different. Then comes palpation. That's the gentle pressing we talked about, where they're feeling for any lumps or tenderness in your glands and muscles. And finally, they assess function, watching how your jaw moves. Each step uses our anatomical map to look for clues about your health.
By understanding this basic anatomy, you're actually empowering yourself. You can explain your symptoms better to a doctor, and you can understand your own body so much better. So the next time you look in the mirror, don't just see a face, see a landscape full of landmarks, and every single one has a story to tell. So the real question is, what story is your anatomy telling you?
All right, let's get right into it. When you think about the human skull, what comes to mind? Probably just a single solid piece of bone, right? Well, it is so much more than that. It's really a masterpiece of biological architecture, an incredible structure built for protection, for communication, for survival. So today, we're going to take a guided tour, an architect's tour, of your own skull. So, that's the big question, isn't it? What really makes the human skull more than just a helmet for our brain? We're about to dive into its hidden complexity. We're talking intricate joints, specialized openings, and some seriously clever design features that serve functions you might never have even thought about.
So, consider this your official welcome to the tour. Understanding the landscape of the skull isn't just for anatomists in a lab. For dentists, for surgeons, for pretty much any clinician, knowing these landmarks is absolutely critical for everything from giving you a shot of local anesthesia to figuring out where an infection is coming from. First things first, let's get a huge misconception out of the way. Your skull, it's not one bone, not even close. It's actually a complex puzzle made of 22 individual bones. Yeah, 22. And they're all intricately locked together by these fibrous joints called sutures. They look like jagged little lines. The only one that gets to move around freely is the mandible, your lower jaw. Okay, so before we can really appreciate the architecture, we've got to learn the language. Bony surfaces aren't perfectly smooth like a marble. Nope, they're covered in all sorts of bumps, grooves, and holes, and every single one of them has a specific name and, more importantly, a specific job. Let's quickly go over the three main categories.
First up, we have prominences. The easiest way to think about these is like they're the hooks, handles, and ridges on the bone. And they're crucial because this is where muscles and tendons grab on, allowing us to do everything from chewing our food to making facial expressions. A perfect example is an arch, which, well, we're going to feel for ourselves in just a minute.
Next on our list are depressions. These are exactly what they sound like: the indentations, the grooves, the hollows on a bone surface. A really big, bowl-like depression is called a fossa, while a skinnier, shallower groove is called a sulcus. They're often there to form part of a joint or to create a nice protected pathway for delicate nerves and blood vessels to run through.
And finally, we have openings. A short little hole, kind of like a window, is called a foramen. A longer, more tube-like passage is a canal. And you can think of these as the highways of the skull. They are absolutely critical, creating these little passages for information and resources, like nerves and blood, to pass between the brain and, well, the rest of the body. All right, with our new vocabulary in hand, let's officially begin our tour of the skull's exterior. And what's cool is that many of these landmarks aren't just some abstract concept in a textbook. They are actual features you can feel on your own face right now.
Go ahead, try it. Just feel for that prominent bone right under your eye. That's it. That's your zygomatic arch, but you probably know it better as your cheekbone. It's one of the most recognizable features of your entire facial skeleton, but the way it's formed, now that's the really amazing part.
See, this is where the skull's clever construction just shines. The zygomatic arch isn't one solid piece of bone. No way. It's actually formed by two different bones, sending out little extensions, or what we call processes, to meet right in the middle. The zygomatic bone, the cheekbone itself, sends a temporal process backward, and the temporal bone from the side of your head sends a zygomatic process forward. They meet up and fuse, creating that strong, elegant arch. So cool.
Okay, now if you move your fingers from your cheekbone up to your temple, you're feeling an area called the temporal fossa. Hey, remember that word fossa? This is a perfect example. It's a large, shallow depression on the side of the skull, and it serves as this incredible meeting point for 5 different bones. It's also where one of the main muscles you use for chewing attaches.
Okay, let's shift gears. We've toured some of the outside architecture. Now we need to look at the critical infrastructure within. We're going inside the skull to check out those inner highways we talked about, the ones that connect the brain to literally everything else.
And these openings, these highways, are everything. Without them, the brain would be totally isolated. The foramen magnum, which is just Latin for great hole, is the biggest one, and it's where the spinal cord passes through. The optic canal, that's the conduit for the optic nerve, carrying everything you're seeing right now to your brain. And the jugular foramen is a major exit for blood to drain from the brain. These aren't just holes, they are absolute lifelines.
So why does all this matter in our daily lives? I mean, this is all fascinating, but let's make it practical. Let's bring this whole anatomical tour into a place many of us are familiar with. The dentist's chair. This is where knowing the skull's architecture becomes incredibly real, very fast.
You know that feeling when your jaw starts to go numb before a procedure? That isn't magic. It's precision targeting. Your dentist is using their deep knowledge of the skull's inner highways to block a very specific nerve at a very specific location. It is a true feat of applied anatomy.
Let's actually trace the path. To get your lower teeth numb, a dentist is targeting something called the inferior alveolar nerve. This nerve enters a hole, a foramen, on the inside surface of your jawbone. From there, it travels through a long tunnel, the mandibular canal, that runs right underneath the roots of your teeth. Finally, it pops out the front through the mental foramen to give feeling to your chin and your lip. The anesthetic has to be delivered with pinpoint accuracy right at the entrance of that very first foramen. And here's another fantastic clinical connection for you. The floor of your maxillary sinuses, those are the big air-filled cavities inside your cheekbones, can be incredibly close to the roots of your upper back teeth. I mean, they're practically neighbors. As this quote explains, this proximity means that a sinus infection can create pressure that feels exactly like a toothache. And it goes the other way too. A bad tooth infection could feel like a sinus problem. It's a perfect example of how knowing these anatomical relationships is the key to getting the right diagnosis.
So, we've seen that the skull is so far from being just a simple box. It's an interlocking puzzle, it's a network of superhighways, and it's a diagnostic map all rolled into one. So the question I want to leave you with is this: what other incredible secrets of our own anatomy are just waiting to be discovered, hiding in plain sight? You know, right now, as you're sitting here watching this, there's this incredible hidden symphony happening across your face. We're about to pull back the curtain on that amazing network of muscles in your head and neck, the very engines that power every single expression, every word, and every connection you make with the world.
I mean, have you ever really stopped to think about it? How a flicker of surprise can just flash across your face in an instant? Well, it all comes down to this complex ballet of tiny muscles firing in perfect, beautiful sequence. And in this explainer, we're going to break down exactly how that magic happens.
So, look at this. On the left, you've got the clinical anatomical map of our face. And on the right, the human result. Our goal today is to bridge that gap, to really see the science humming away behind every single one of our everyday expressions.
Okay, so how does this whole engine of expression actually work? Before we dive into the specific muscles, we need to get our heads around one fundamental principle that rules them all. And honestly, it's surprisingly simple.
Every single muscle plays by the same basic rule. It's got two ends. First up, you have the origin. Just think of this as the anchor point. It's the end that's attached to a structure, usually a bone, that's not supposed to move. It stays put. And then, on the flip side, you've got the insertion. This end is attached to the part you actually want to move, like your skin or another bone. The real magic happens when that insertion point gets pulled toward the origin. This classic diagram of a bicep curl is the perfect way to picture it. To bend your arm, the muscle contracts, and it pulls the insertion point on your forearm up toward the origin on your shoulder. That's it. Keep that simple idea, insertion pulls toward origin in your head, because the exact same thing is happening with every muscle in your face, just on a much, much smaller and more intricate scale.
All right, let's start with the heavy lifters. Before we can even make an expression, we need a stable platform, right? And that's the job of the super powerful cervical muscles in your neck. They're the ones holding and positioning your head all day long.
And the biggest player on the team back here is the trapezius. It's this massive, flat, triangular muscle that covers the back of your neck and your shoulders. You're probably very familiar with this one, even if you don't know it by name. So, how does it work? Well, its origin, the anchor, remember, is on the back of your skull and down your spine. It then inserts or attaches way out on your collarbone and your shoulder blade. So when it contracts, it pulls those insertion points up and you get a shrug. It's that simple. Of course, this is also where a lot of us hold our stress and tension. Things like poor posture or sitting at a desk all day can lead to chronic pain right in these muscles. It's a direct result of the constant, hard work they do just to support our heads.
All right, let's shift gears. We're moving from the big structural supports to the real artists, those delicate, super intricate muscles that create this incredible masterpiece of human emotion right on your face.
Now here's a really fascinating fact that ties all of this together. Every single muscle we're about to talk about gets its instructions from one single source, the seventh cranial nerve. It's like the master conductor for your face's entire orchestra. But think about this. It also means there's a single point of failure. Any damage to this one nerve can literally paralyze and silence an entire side of the face. So let's start at the very top with the epicranial muscle. It's got two parts, a frontal belly right over your forehead and an occipital belly at the back of your head. When that front part contracts, it pulls up the skin of your eyebrows and your scalp, giving you that universal look of surprise.
Now for its opposite. Tucked right between your eyebrows is this little guy, the corrugator supercilii. It might be small, but it is powerful. When this one contracts, it pulls your eyebrows together and down, creating those vertical wrinkles you get when you're concentrating really hard, or you're worried, or just plain frowning.
Circling each of your eyes like a little gatekeeper is the orbicularis oculi. Its number one job is protection. It closes the eyelid to shield your eye from danger and to keep it moist. It also, of course, lets us squint, and yep, this is the muscle that's responsible for creating those crow's feet over time. Okay, let's move to the center of it all, the mouth. This area is unbelievably complex. It's home to a whole team of muscles that are responsible for, well, everything, from talking and eating to showing the most subtle of smiles. And the star of the show right here is the orbicularis oris. It's basically a ring of muscle that acts like a drawstring for your mouth. Now, what's so unique about this one is that it has no direct bony attachments. It's just woven right into the skin and the other muscles of the lips, which gives it this incredible fine-tuned control. I mean, think about the range this one muscle gives us. We can press our lips together to close them, we can tighten and fin them to purse them, we can roll them inward when we're grimacing, and we can thrust them out when we're pouting or kissing. It's just incredibly versatile. And these images really show just how crucial this muscle is. On one side, you can see what happens when it loses its function. It can lead to some pretty serious facial asymmetry. And on the other, you can literally see how a repetitive habit like smoking can create deep wrinkles from that constant pursing action. So we've looked at all these individual players, but the real magic, the real story, is how they all work together in this seamless, totally subconscious symphony. Every single moment of every day, these muscles are contracting and relaxing. That powerful shrug from your trapezius, a worried frown from the corrugator, a joyful smile that uses a dozen muscles all around your mouth, they all combine, moment to moment, to create the you that the world sees. When you think about it, the lines on our face, the way we hold our head, the expressions that come most naturally to us, they're the physical record of our lives. Your muscles are constantly telling your story. So the only question left is, what story is yours telling?
All right, welcome. Today, we're taking a tour of the hidden highways inside your own head. Seriously, we are going to explore the unbelievable engineering that goes into something as simple as a yawn and how it's all connected to some of the most vital and dangerous intersections in your entire body. Think about it. Chewing, talking, yawning. It all feels so automatic, doesn't it? But behind that simple motion is an absolute marvel of biological machinery. So let's pull back the curtain and take a look at this incredible system that you use literally thousands of times a day without a second thought. And right here, this is where it all begins. This is the mandible, your lower jaw. It's the powerhouse of your face. It's the largest, the strongest, and get this, the only bone in your skull that's designed to move. But to just call it a simple hinge, oh, that would be a massive understatement. It's the anchor for a whole system of ridiculously complex movements. So, if it's not just a hinge, what's the engine driving this whole operation? Well, let's meet the star of the show. It's a joint that is truly unlike any other in your body. This right here is the temporomandibular joint, or as most people know it, the TMJ. You've got two of them, one on each side. In fact, you can feel it working. Just place your fingers right in front of your ears and open and close your mouth. That little bit of machinery you feel moving, that's it. It's where your jaw connects to your skull, and it's way more than just a joint. So what's its secret? How does it do what it does? Look closely at this diagram. See that little fibrous disc tucked between the two bones? That little guy? That shock absorber. That's the secret sauce. It actually splits the joint into two separate compartments, an upper one and a lower one. It basically creates two joints in one. And here is where the design is just pure genius. That lower compartment, it acts like a simple hinge, for opening and closing your mouth. But at the same time, the upper compartment works like a sliding door, letting your jaw glide forwards and backwards. It's this 1-2 punch of rotating and gliding simultaneously that gives your jaw its incredible range of motion. Now, of course, the joint itself doesn't have a motor. It's powered by 4 pairs of incredibly strong muscles. These are the muscles of mastication, a fancy word for chewing. If you clench your teeth right now, you can feel 2 of them bulge on the side of your head and jaw. Those provide the brute force, while the other 2 handle all the finer side-to-side movements. Okay, so we have this incredible machine, but how does it get its fuel? How does it stay powered up? Well, that brings us to the vascular system. Every single one of those muscles and bones needs a constant supply of oxygen and nutrients, and the delivery system is just as sophisticated as the joint itself. So, at its most basic level, the vascular system is pretty much a high-speed delivery network. You've got arteries, which carry fresh, oxygenated blood away from the heart. Then you've got capillaries. Think of these as the local delivery routes, where oxygen gets dropped off to the tissues. And finally, you have the veins, which are the return route, bringing all the used, deoxygenated blood back to the heart. Now, 2 massive arteries act as the main highways for blood flowing into your head. The most famous one is the common carotid artery. If you've ever checked your pulse in your neck, that's the one you're feeling. It's a superhighway that branches off to supply everything from your brain to your face to your teeth. And these structures are so absolutely critical that they get their very own protective wrapping. It's called the carotid sheath. You can think of it like a tough, fibrous tube that neatly bundles together the main artery, the main vein, and a major nerve, keeping this vital lifeline safe as it travels up through the neck. Okay, so now we're going to see how these 2 systems, the jaw and its plumbing, intersect. And this is where things get really, really interesting, especially in medicine and dentistry. Because the head and neck is such a densely packed area, we're talking about a place where millimeters can make all the difference. So why on earth does your dentist need to be an expert on this complex vascular map? Well, the answer is hiding in a really crowded neighborhood of veins, located surprisingly close to where certain dental injections have to go. I want you to meet the pterygoid plexus of veins. It's not just one vein, it's a whole web, a big, complex junction box of blood vessels tucked deep behind your jaw. Its main job is to act as a cushion, protecting a major artery from getting squished when you chew. But its location also makes it a bit of a high-risk zone. And here's why that matters. To get your upper back teeth numb, a dentist has to guide a needle right past this delicate web of veins. If that needle goes just a fraction too far back, it can actually puncture the plexus. And the result? A hematoma. It's basically a big, sudden, and pretty painful bruise that swells up inside your cheek almost instantly. Now, a nasty bruise is one thing, but there's actually a far more serious risk hiding in the head's venous system. You see, because of the way some of these veins are connected, a simple infection has the potential to take a very, very dangerous shortcut. This is the cavernous sinus. It's a collection of veins located inside your skull, right up against the brain. And here's the truly scary part. It has a direct line of communication with that pterygoid plexus we just talked about. This means an infection from a tooth could, in a worst-case scenario, travel into that plexus and then take a direct route straight into the brain. It's a rare event, but it's why dentists take infections so seriously. Okay, let's zoom back out from those critical, high-stakes risks to something that a lot more people experience directly: jaw pain. Because when the elegant mechanics of the TMJ get thrown out of whack, the results can be truly miserable. Believe it or not, your teeth aren't actually supposed to be touching most of the time. When your jaw is truly relaxed, there should be this tiny little 2 to 4 millimeter gap. Dentists call it freeway space. The problem is, when we're stressed, we tend to clench or grind, and we completely eliminate that space, putting the whole system under constant damaging pressure. And all that constant strain can lead to something called temporal mandibular disorder, or TMD. And we're not just talking about a clicking jaw here. This can cause chronic headaches, really painful muscle spasms, even limit how wide you can open your mouth. But here's a key insight. For a lot of people, the problem isn't the joint itself, but actually the exhausted, overworked muscles that surround it. Besides that kind of chronic pain, more sudden, acute problems can happen too. Ever had a really big yawn and felt like your jaw almost got stuck? That's called subluxation. It's when the joint slides a little too far forward and has trouble getting back. Trismus, or lockjaw, is basically the opposite. It's a painful inability to open your jaw, often because of severe muscle spasms. So, when you put it all together, from the elegant mechanics of the TMJ with its amazing hinge and slide system, to the vital vascular highways that power the whole thing, and even the dangerous intersections where they meet, it's all one deeply, intricately interconnected system. And that really is the biggest takeaway here. The head and neck is an area of incredible density. Everything is packed in so tightly. That's what makes it so efficient, but it's also what makes the stakes so high. Everything is just millimeters away from everything else, and that's how a simple toothache can have a potential pathway straight to the brain. It's a pretty powerful reminder of all the hidden complexity that's powering our everyday lives. So the next time you yawn, maybe you'll think about it differently. It's never just a yawn. It's a symphony of bones, muscles, ligaments, and blood vessels, all working together in perfect harmony. All right, let's talk about a place we're all familiar with, but maybe don't really know: the dentist's chair. Today, we're exploring the hidden risks, the unseen challenges that your dental team is navigating every single time you sit down. You know, while you're focused on all the strange sounds and the weird sensations, have you ever wondered what they're concentrating on so intensely? What is it that requires their complete and total focus? Well, here's the thing. It's not just about your teeth. They're looking at this incredibly complex, hidden map of blood vessels. Your head and neck are just crisscrossed with this dense network of arteries and veins. It's like a biological superhighway system, you know? Absolutely essential for life, but it's also packed with potential hazards. And for dental professionals, navigating this map, well, that's the whole game. Because one wrong turn, one tiny little slip, can lead to some surprisingly serious problems. So let's take a closer look at that map, shall we? Okay, first things first. To even begin to understand this hidden map, we need to get a handle on the roads. We're going to do a super quick guide to the vascular system. Just 3 key terms you got to know. First up, arteries. Pretty simple, right? Think of these as the main supply lines. They're the big freeways carrying all that oxygen-rich blood away from the heart and out to all the tissues in your head and neck. Got it? Good. Okay, next we've got veins. If arteries are the freeways going out, veins are the return routes. They're collecting all the used, deoxygenated blood and all the waste products, carrying it all back to the heart. And this one's a biggie, a plexus. Now, a plexus isn't just a single road. Oh no, it's a huge, tangled network of blood vessels. Imagine a massive, complex highway interchange where countless vessels all meet up. As you can probably guess, these spots are super important for dental professionals to know like the back of their hand. So now that we've got our basic roadmap down, let's talk about the first potential hazard you might encounter on these hidden highways. And believe it or not, this is a risk that can pop up during the most routine thing you can imagine, a simple teeth cleaning. This risk has a name, bacteria, and it's exactly what it sounds like, bacteria in the bloodstream. See, your mouth is just teeming with bacteria, and your gums are incredibly vascular. So during a cleaning, it's actually really easy for a little bit of that bacteria to get nudged into the bloodstream. So what's the big deal, right? Well, here's where it gets interesting. The answer completely depends on who's in the chair. For most of us with a healthy immune system, it's no problem. Your body just cleans it up, no sweat. But for a high-risk patient, maybe someone with a prosthetic heart valve, those exact same bacteria can take a dangerous detour straight to the heart and cause a life-threatening infection. This is why they are so meticulous about your medical history. It's their first and most important line of defense. Okay, on to risk number 2. This one's a bit more visible. We're talking about what can happen when that tiny little needle for the local anesthetic takes a slight accidental detour. And the result? A hematoma. We all just call it a bruise, right? In the dental world, it happens when the tip of that anesthetic needle just nicks a blood vessel. That lets blood leak out into the tissue around it, and boom, you've got a bruise. But what's really fascinating here is that there's a specific danger zone for this. Remember that complex highway interchange we talked about, the plexus? Well, there's a major one called the pterygoid plexus of veins. It's tucked away deep in your cheek, right behind your upper molars. You can think of it like this hidden, busy traffic circle that the needle has to carefully navigate around. So picture this. A dentist or hygienist is giving you a shot to numb up those upper molars. It's called a PSA block. Their needle is passing right by this plexus. If that needle goes just a fraction too deep, or maybe at a slightly wrong angle, it can puncture this dense web of veins, and that can lead to a really fast, really noticeable hematoma. It's just a perfect kind of scary example of why precision is absolutely everything. And that brings us to our final and definitely most serious risk. We're about to connect that very same danger zone, that pterygoid plexus, to something way more severe than just a bruise. To get this, we have to go even deeper, like inside the skull. There's this structure called the cavernous sinus. It's basically a collection of veins right next to the brain, and it acts as a central drainage hub for the whole middle part of your face. And here is the absolute crucial point. The cavernous sinus inside your skull has a direct line of communication with the pterygoid plexus of veins. Yep, the same one we've been talking about near your upper teeth. This quote from our source material just lays it out perfectly. It's a direct pathway for dental infections to spread right into the cranium. So you can see how this terrifying chain of events could happen, right? An untreated dental infection, like a nasty abscess, starts to spread. It gets into that nearby pterygoid plexus. From there, well, it's got an express lane. The infection travels right up that direct venous pathway, straight into the cavernous sinus, and causes a blood clot. The condition is called cavernous sinus thrombosis, and it is incredibly dangerous. It can be fatal. Okay, I know that was a lot, and it's totally natural to feel a little freaked out hearing about these worst-case scenarios. But now we get to the most important part of the story, why these things almost never happen. And it all boils down to the incredible training, skill, and knowledge of your dental team. It really all comes down to this one fundamental principle. A registered dental hygienist, an RDH, they have to have this expert-level, 3-dimensional mental map of every single vessel in your head and neck. That knowledge isn't just for tests. It's the primary tool they use every single day to keep you safe. That knowledge is literally their shield, and they use it in very specific, deliberate ways. They pore over your medical history to see if you're at risk for bacteremia. Their deep understanding of anatomy helps them steer clear of major vessels to prevent those hematomas. And before they ever inject, they always aspirate. That means pulling back on the plunger just a bit to double check they haven't accidentally entered a blood vessel. And of course, they are absolutely vigilant about treating any infection before it even has a chance to think about taking that dangerous path to the brain. Every single step is a calculated safety measure. So, the real takeaway from all this is pretty simple. The next time you're leaning back in that chair, just remember that what's happening is so much more than a scraping and a polish.
It is a constant, real-time application of incredibly deep anatomical knowledge, and it's all designed for one single purpose: to keep you safe while they navigate that hidden, complex map inside your own head.
It kind of makes you wonder, doesn't it? What other seemingly simple things in our daily lives are actually being managed by this incredible, unseen expertise? What hidden complexities are you going to notice in your world today?
You know, what are things like a runny nose when you cry, those classic chipmunk cheeks from mumps, or even unexplained anxiety have in common? Well, believe it or not, they can all be traced back to the tiny but incredibly powerful glands in our head and neck. Today, we're going to dive into what these glands do, and more importantly, the crucial clinical signs you'll need to recognize.
All right, so here's our game plan. We'll kick things off with the two main types of glands. Then we'll explore the ones that protect us on the outside. After that, we're moving to the internal control panel. We'll also get into what happens when things go wrong, and, this is the big one, how you can spot the signs in your patients.
Okay, first things first. We need to break down the two fundamental ways these glands operate. It really all comes down to their delivery system. So, at its most basic level, a gland is like a tiny, specialized factory. It's constantly producing essential chemicals that do everything from lubricate and digest to regulate and protect our bodies.
And here's the key difference, and it all comes down to plumbing. Exocrine glands have ducts. Think of them like tiny, dedicated pipelines that deliver their product directly to a specific spot. Endocrine glands, on the other hand, are ductless. They just release their hormones straight into the bloodstream and let the circulatory system do the delivery work. So let's start with those outer guards, the exocrine glands, and we'll begin with the ones that protect our very eyes.
Ever wonder why you get a runny nose when you cry? It's all thanks to the lacrimal glands. They produce tears, but those tears don't just disappear. They actually drain through a little tube, the nasolacrimal duct, right into your nasal cavity. Simple anatomy explaining an everyday experience. And of course, when this system isn't working right, you can end up with dry eye syndrome.
Now, let's move into the mouth. We tend to think of saliva as, well, just water, right? But it is so much more than that. It's a complex fluid that's a key part of our immune system. It kicks off digestion with enzymes, and it's constantly washing over our teeth, cleansing the entire oral cavity. We've got three major pairs of these salivary glands. Now take a look here. The parotid is the biggest one, but notice its nerve supply. That's cranial nerve 9. The other two, the submandibular and sublingual, are both supplied by cranial nerve 7. That distinction is absolutely critical in a clinical setting because any nerve damage is going to show up differently depending on which gland is involved.
So, knowing how things are supposed to work is great, but as clinicians, we really need to know what to look for when these systems start to fail.
Let's talk about a really high-stakes scenario, one that involves the biggest of the salivary glands, the parotid.
This is exactly why anatomical precision is completely non-negotiable. When you're giving an inferior alveolar block, if that needle goes just a little too far back, it can pierce the parotid gland. And guess what runs right through the middle of that gland? The facial nerve. If you traumatize that nerve, you can cause temporary facial paralysis. Can you imagine how terrifying that would be for a patient?
Of course, there are other issues too. You've got viral infections like mumps, which causes that classic chipmunk cheek swelling, all the way to physical blockages like salivary stones, which you can often actually feel during an extraoral exam. Okay, let's switch gears. We've talked about the outer guards with their ducts. Now, let's go deeper and look at the inner regulators, the powerful ductless endocrine glands.
This trio basically forms a powerful internal control panel. The thyroid, that's your body's thermostat, setting your metabolic rate. Those tiny little parathyroid glands are the masters of calcium and phosphorus balance, vital for nerves and muscles. And the thymus? Think of it as a boot camp for your immune system's special forces, the T cells.
Now, we're really going to zoom in on the thyroid for a bit, because its impact on the body is massive, and yet its disorders are so often hidden in plain sight.
Just let that number sink in for a second. 20 million people. That is a huge number of people affected by thyroid issues. But here's the part that really gets me. Out of those 20 million, a huge majority, 13 million of them, don't even know they have a problem. This is exactly why your clinical assessment skills are so vital. And here's why so many cases get missed. Look at these symptoms. They're incredibly vague. Fatigue and weight gain from an underactive thyroid? That could just be chalked up to getting older or feeling down.
nervousness and heart palpitations from an overactive one, that looks a whole lot like an anxiety disorder. It's so easy to misdiagnose.
So, as a clinician, what can you actually do? What are the tangible signs you can look for and, physically feel during an examination? It comes down to this simple 3-step process. You locate the gland, you feel for any enlargement or nodules, and then, and this is the most critical part, you test its mobility. This right here is probably the most important thing you need to remember from this whole discussion. A healthy thyroid should move up and down when a patient swallows. If you feel it and it seems fixed in place, not moving, that is a major red flag. It could mean a tumor has attached it to the surrounding tissue, and that patient needs an immediate referral.
And finally, always remember that the physical exam is only one piece of the puzzle. A thorough medical history is where you find the other pieces. Things like autoimmune diseases or past radiation exposure are huge risk factors you need to know about. You see, these glands, they might be small, but their impact on our health is absolutely massive. Being able to recognize their subtle signals isn't just a party trick, it's a foundational skill. By connecting the anatomy to the clinical signs, you're not just memorizing facts, you're learning how to actually protect your patient's health.
All right, today we are going on a little journey inside your own head. We're going to unravel the incredible wiring of your head and neck and focus in on the one nerve that really matters when you hear your dentist say those 3 famous words, open wide. So yeah, let's jump right in. You know that feeling, right? It is so strange. The dentist gives you one little shot and suddenly an entire chunk of your face just disappears. I mean, you can touch your lip, you know it's there, but your brain has absolutely no idea. So how do they do it? How does that magic trick actually work? Well, the secret lies in what we could call the body's information superhighway. So, to figure out how a signal gets blocked, we first have to understand how it's sent in the first place, right? And it all starts with the most basic building block of this whole system. And that's the neuron. Seriously, the best way to picture it is like a single tiny wire in this massive, sprawling electrical grid that is your entire body. Its one and only job is to carry information, connecting your brain to, well, literally everything else. Okay, so this highway isn't just a one-way street. There are 2 directions of traffic, and this is super important. First, you've got your afferent nerves. These are sensory nerves, and they carry information to the brain. The little memory trick here is perfect. A for approaching the brain. This is how you feel pain, taste, touch, all that stuff. Then, going the other way, you have your efferent nerves. These are motor nerves, and they carry commands from the brain. So think E for exiting the brain. These are the signals that tell your muscles, hey, time to move. So what's the actual message that's flying down these wires? It's something called an action potential. You can just think of it as a little spark of electricity, a super quick pulse. It's basically the you've got mail notification for your nervous system, carrying messages like, ouch, that's hot, or okay, let's start chewing. All right, quick recap. We've got the wires, the neurons. We've got the directions of traffic, afferent and efferent. And we've got the messages themselves, the action potentials. But, in a place as complicated as your head, this wiring isn't just a jumbled mess. It's all organized into these very specialized teams. So let's meet the managers of this whole operation, the cranial nerves. Yep, there are 12 pairs of these things, and you can think of them as the absolute VIPs of your nervous system. Each one has a very specific, super important job, and what's wild is that they're all hardwired directly into the brain. They completely bypass the spinal cord. And here they are, the whole team. Just look at this list. It's amazing, isn't it? I mean, they're responsible for everything from your sense of smell and your sight, all the way to the tiny muscles that move your eyes. But for our story today, we're zooming in on one in particular. Right there in the middle, cranial nerve number 5, the trigeminal nerve. And look closely at its type. See that? Both. That is a huge clue. This nerve is a real double agent. It handles both sensory stuff and motor functions. So it's time to put our main character under the microscope. The trigeminal nerve. It's not just a single nerve. Oh no. It's a total powerhouse that splits into 3 major branches. A real nerve trio. And that quote right there, that is not an exaggeration. Ask any dentist or dental hygienist. To them, this nerve is the whole shebang. And why is that? Well, it's pretty simple. It's connected to basically everything they touch. We're talking your teeth, your tongue, your gums, even most of the skin on your face. So the big takeaway here is its massive size and that dual functionality we just talked about. I mean, it really is the heavyweight champion of the cranial nerves. It's got those afferent or sensory roots that lets you feel things like a toothache. And it's got the efferent or motor roots that control the powerful muscles you use to chew. Okay, so let's break this trio down piece by piece. First up, we've got Division 1, or V1. That's the ophthalmic nerve. This branch is purely sensory, and it's in charge of the upper part of your face. So think forehead, scalp, even your eyeball and cornea. All right, moving down, we have Division 2, V2, the maxillary nerve. This one takes care of the middle section of your face. And this is where it gets absolutely crucial for dentistry, because this branch is what provides all the feeling for your upper jaw, what's called the maxilla. And yep, every single one of your top teeth. And finally, rounding out our trio, we have V3, the mandibular nerve. Now this one is the really special one. It's the only branch of the three that does both jobs. It's afferent, bringing in all that sensory information from your lower jaw, your tongue, your bottom teeth, and it's efferent, sending out the motor commands to your chewing muscles. It is the ultimate multitasker of the face. Okay, so we've mapped out the whole network. We know all the players and what they're responsible for. And that means we can finally circle back and solve our original mystery. How does that dental anesthetic actually work its magic? And on the flip side, what happens when this incredible system goes wrong all by itself? So this is it. This is how that numb feeling happens. It's just brilliant chemistry. The local anesthetic, that stuff they inject, it seeps right into the nerve cell. And it basically acts like a bouncer at a nightclub door, but for your nerve. It physically blocks these little things called sodium channels. Remember that action potential, that little electrical spark that is the pain signal? Well, it can't fire if it can't get through the door. The message is all ready to go, but it's stuck. It never gets sent. Your brain gets nothing but radio silence, and you feel absolutely nothing. It's amazing, isn't it? But what happens when the nerve isn't being blocked on purpose? What if the nerve itself is the problem? Well, that can lead to a condition called trigeminal neuralgia. What happens is something, often a blood vessel, starts pressing on the nerve, and it just makes the whole signaling system go completely haywire. The result is just this sudden, severe, and absolutely debilitating facial pain. And just look at what can trigger it. This is the really heartbreaking part. We're not talking about some big injury. We're talking about the simplest things: chewing, speaking, brushing your teeth. Even something as gentle as a cool breeze on the face can set off an attack of excruciating pain. It's a truly devastating condition, and it really highlights just how critical this nerve's normal function is to our daily lives. Okay, so to really hammer home what the trigeminal nerve does, it's super helpful to compare it to its next-door neighbor, cranial nerve number 7, the facial nerve. They work in the same neighborhood, so to speak, but their jobs couldn't be more different. See, when the facial nerve gets inflamed, it can cause something called Bell's palsy. And what that is a paralysis of the muscles in your face. So think about the contrast here. It's so important. Trigeminal neuralgia is a sensory problem. It's all about feeling intense pain. Bell's palsy, on the other hand, is a motor problem. It's about not being able to move your muscles, to smile or to blink properly. It is the perfect real-world illustration of the difference between those sensory, afferent pathways and those motor, efferent pathways we started with. So think about the journey we just took. We started with a really simple question. Why does my lip feel numb? And we ended up mapping this entire superhighway inside our own skulls. We met the star player, the trigeminal nerve, and we even figured out how dentists can throw up a temporary roadblock with anesthesia. The big takeaway here is that our ability to do everything, to feel, to chew, to just be, it all relies on this incredibly complex and precise wiring. And that leaves us with a pretty mind-bending question, doesn't it? If we're already this good at blocking these signals, what if one day we could actually rewrite them? Could we potentially end chronic pain for good? You know that feeling. You're sitting in the dentist chair, and that weird tingly numbness starts to spread across your face. It's a sensation pretty much all of us have felt, but what's actually happening? Well, today we're going to pull back the curtain on that mystery. I mean, it's a classic experience, right? You go in for a filling on just one little tooth, and suddenly you can't feel your upper lip or the side of your nose for hours. It seems like total overkill, but there's a really fascinating reason for it, and it all comes down to the hidden electrical wiring of your face. Yeah, that injection isn't just some random poke with a needle. It is a highly calculated, precise strike. The whole point is to stop a pain signal before it can even begin its journey to your brain. And to pull that off, dentists have to be expert navigators of this hidden landscape inside your body. So, to really understand how this works, first you gotta meet the master controller of pretty much all feeling in your face. It's this massive nerve that acts like a superhighway, and it's the main target for almost any dental work you're having done. This right here is the trigeminal nerve. Think of it like a giant tree trunk with major branches that spread all across your face, kind of like a complex highway system. So when a dentist numbs a tooth, they aren't really aiming for the tooth itself. Nope, they're setting up a roadblock on one of these highways to stop the traffic, the pain signal, dead in its tracks. And this highway carries signals from almost everywhere. The anesthetic is amazing stuff. It works by blocking these tiny little gates on the nerve cells called sodium channels. That means the electrical pain signal physically cannot get through. It is a literal communication blackout. So by targeting a main branch, you can numb every single area that branch connects to, from your teeth all the way out to the side of your nose. Now, dentists have two main strategies for setting up these roadblocks. It really just depends on how much of the highway they need to shut down for the job. So on one hand, you've got what's called local infiltration. This is kind of like blocking a small residential side street. It just numbs one or two teeth by targeting the tiny nerve endings right at their destination. But then you have the nerve block. This is the big one. This is like shutting down a major freeway interchange. It numbs an entire section of your mouth by hitting the main nerve trunk way farther back from the teeth. So let's focus on those bigger nerve blocks because they're the most interesting. We're going to take a little guided tour of the upper jaw, the maxilla, to see how a dentist navigates this incredible internal map. And it's worth noting, the lower jaw is a totally different ballgame. Its bone is way denser, so it usually needs one single major nerve block for the whole side. But for now, let's explore the amazing network of the upper jaw. Okay, here's our roadmap. See all those colors? Each one represents a different nerve's territory. We're going to start way in the back, in that yellow zone. This is the turf of the posterior superior alveolar nerve, or PSA for short. This is the go-to target when you're having work done on your back molars. A really good PSA block does a lot more than just numb the teeth. It gets the pulp, that's the living tissue deep inside the tooth, and all the supporting structures. And that's just a fancy way of saying the gums and bone on the cheek side of your molars. So you can think of it as a full-service stop for the back of your mouth. And the landmark for this shot is incredibly specific. The dentist is aiming for a spot way up in the fold where your cheek meets your gums, all the way back behind your second molar. I know, it feels like the back of Beyond when you're in the chair, but that is the exact spot they need to hit to get to the PSA nerve. Okay, moving forward on our map, we're now entering this light yellow area. This territory belongs to the middle superior alveolar nerve, or MSA. This guy is responsible for your premolars, the teeth that are nestled between your canines and your molars. So the MSA block takes care of both of those premolars and all the tissue around them. But notice that little detail? It sometimes also covers one root of the first molar. And that is a fantastic clue that human anatomy isn't always straight out of a textbook. And this is where it gets really interesting. That MSA nerve we've been talking about, it's only present in about 28% of people. 28%! For the vast majority of us, that nerve just isn't there. Its job is handled by the nerves on either side of it. Isn't that wild? It's just a reminder that every single person's internal map is a little bit unique. All right, our final stop on this tour of the upper jaw takes us right to the front, into the blue-green area. This is the territory of the anterior superior alveolar nerve, or ASA, and it's responsible for what a lot of people call the smile teeth. This block numbs up your canines and incisors and all the gum tissue right in the front. And because of where this nerve trunk lives, the anesthetic doesn't just hang out by the teeth. It spreads to the surrounding soft tissues, which finally answers our big question from the beginning. This is exactly why your upper lip and the side of your nose go numb. Okay, let's zoom back out for a second. We've seen the map, we've seen the different nerve territories, and now I think we can really appreciate the incredible skill it takes to actually hit these targets. I mean, just look at this. On the left, you see the simple external thing that's happening, the injection. But on the right, you see the reality of it, a complex, hidden world of anatomy that the dentist is navigating purely by feel and by knowledge. They are aiming for a tiny little bullseye on a three-dimensional map that they literally cannot see. So at the end of the day, a dental injection is so much more than just a needle. It is applied science happening in real time. It's a testament to this profound understanding of the human body, where knowledge of nerves and bone and tissue all comes together in one single precise moment. So the next time you're in that chair and you feel that familiar numbing sensation start to creep in, maybe you'll think about it a little differently. You're not just getting a shot, you're experiencing a live demonstration of the intricate, invisible map that makes you, well, you. And it's a pretty cool reminder that even in the most common experiences, there is an incredible world of science just waiting to be discovered.
All right, today we're diving into this incredible network in your body that's always working behind the scenes. It's called the lymphatic system, and honestly, it's a huge player in your health, and I'm willing to bet you've already felt it in action.
You know that feeling, right? You're starting to get sick, maybe a little run down, and you feel around your neck, and there they are, those little tender lumps. So what exactly is that? What's going on there?
Well, what you're feeling is your lymphatic system kicking into high gear. Those swollen glands are actually your lymph nodes, and they're basically sending out a signal that your body's defense team has been scrambled and is already on the job. So let's really get into this, because this system is so much more than just a couple of glands you feel when you're sick. It's truly one of the most important, but maybe one of the most overlooked, security systems in your whole body. Okay, so what is it really? Well, think of the lymphatic system as this massive, interconnected network of tubes and organs. Its main job is to move a clear, watery fluid called lymph all around your body and back into your bloodstream.
Yeah, and a really great way to think about it is like your body's own sanitation and security department all rolled into one. It's part garbage collector, cleaning up waste from your tissues, and part security guard, playing a huge role in your immune system. And this department has a whole crew, right? You've got the lymphatic vessels. Those are the highways the lymph fluid travels on. Then you have the lymph nodes. Think of them as hundreds of little filtration stations or security checkpoints. The lymphatic ducts are the big pipes at the end of the line. And yeah, even your tonsils are part of this team, acting like gatekeepers.
Okay, so to really get how this whole security system works, we've got to follow the fluid itself. Let's trace the path of lymph as it goes into one of the most important spots in the whole network, a lymph node.
So here, we're looking deep inside a lymph node. It might not look like much at first glance, but what you're seeing is basically a microscopic war zone. This is where the real fight against invaders goes down. So how does it work? Well, it's kind of like a high-tech water filter. You have the dirty fluid, the lymph, coming in through a bunch of different pipes. Inside, you've got these specialized immune cells that are basically screening everything, grabbing and destroying nasty stuff like viruses and bacteria. And then, the clean, filtered lymph flows out through a single exit pipe to get back on its way.
All right, so now that we know what these nodes are up to, let's figure out where they are. We're going to zoom in on the head and neck, mostly because this area is just jam-packed with them, and honestly, they can tell us a ton about what's going on with our health.
And wow, just look at this map. It really shows you just how dense this network is. It's this incredible, complex web. Every single one of those little dots is a lymph node, and they're all strategically placed to guard this really important part of your body. And this isn't random. It's like a super practical map for your health. See, different groups of nodes are assigned to different zones. Like the submental nodes right under your chin, they handle your lower front teeth. So a toothache there might make those nodes swell up. The submandibular nodes take care of most of your other teeth. That's why your dentist is always feeling under your jawline. And those deep parotid nodes, they're connected to your ears. So an ear infection could make them swell. It's just a remarkably organized system. And all this swelling actually has a fancy medical name, lymphadenopathy. I know, it sounds a little intense, but all it means is enlarged lymph nodes. It's not a disease itself. It's just the signal that your body is in the middle of a fight. So, how do you know what's normal? Well, healthy lymph nodes are usually small, they feel soft, and you can kind of move them around under your skin. But when they're fighting something off, they get bigger, they're tender when you press on them, and they can feel hard or even stuck in one spot. This is a really good thing to be aware of for your own health. Okay, now let's move on to another really famous part of this system. These guys are like the frontline soldiers stationed right at the main entrance to your throat. Of course, I'm talking about the tonsils. And this image says it all, doesn't it? On the left, you've got normal, healthy tonsils, and on the right, well, that's what happens during a nasty infection. The difference is just whoa. It's a perfect picture of the lymphatic system in action. And see, your tonsils aren't just there for no reason.
They are these strategically placed clumps of lymphoid tissue just packed with immune cells. I love the analogy of them being like bouncers at a club. They're checking everything that tries to come in through your mouth and nose. And just so we're clear, when most of us talk about our tonsils, we're talking about the palatine tonsils, the ones you can actually see if you open your mouth wide. So here's the million-dollar question. Why does a sore throat give you a swollen neck? Well, this slide shows you exactly why. When your tonsils are battling an infection, all that gunk, all that inflammatory stuff has to go somewhere. It drains down into a specific group of lymph nodes deep in your neck. And when those nodes get overwhelmed, they swell up. And that's the lump you feel.
So, we've seen the lymphatic system is amazing at handling local problems, right? Like a sore throat or an infected tooth. But sometimes it sounds an alarm about something much, much bigger. It can be a critical warning system for your entire body.
See all of those little vessels and nodes we've been talking about? They all eventually merge together and funnel everything into two main drainage pipes. Think of it like a bunch of small streams flowing into two giant rivers. The thoracic duct is the big one. It handles about 3/4 of your whole body. Everything eventually passes through these two ducts to get back into your blood.
Okay, but let's zoom in on one very specific, very important group of nodes. They're located right near this final drainage point. They're called the supraclavicular nodes, and they're right in that little hollow just above your collarbone. And trust me, their location is no accident. It is super important.
And this is why. Because they're basically the last checkpoint for lymph fluid coming from huge areas of your body, they're also the most likely place to catch cancer cells that have broken off from a tumor and are trying to travel and spread.
This is what makes them so absolutely critical in medicine. If there are cancer cells traveling from the breast or the lungs or even the abdomen, there's a very high chance they'll get caught right here, in these supraclavicular nodes. And that's exactly why this spot is one of the most important places a doctor will check during a physical exam.
So you see, from a simple swollen gland telling you you've got a cold to being a critical sign of a much more serious disease, your lymphatic system is constantly working, constantly monitoring, constantly protecting you. It really is your body's silent guardian, its unsung hero. So the final question is, are you listening to what it's trying to tell you? All right, welcome. Today we're diving into a kind of medical detective story, one that's happening right inside our own bodies. We're going to uncover this hidden network that can turn a problem you might think is simple into a life-threatening emergency. So let's get right into it.
And it all kicks off with this question. Now, I know it might sound a little dramatic, but believe me, this threat is very, very real. The thing is, the answer isn't really in the tooth itself. Nope, it's in the secret pathways that connect it to, well, everything else.
So to get to the bottom of this, we've got to look at a part of our anatomy most of us have probably never even heard of. But, and I promise you this, you've definitely seen it before. Okay, meet our primary subject, fascia. Now, the official definition, the textbook one, calls it layers of fibrous connective tissue. A simpler way to think about it, it's basically the body's internal scaffolding. It wraps around and connects literally everything under our skin. And hey, if that still sounds a bit abstract, don't worry, I guarantee you know exactly what this stuff is. Have you ever cooked with raw chicken or steak? You know that thin kind of silvery, clingy film that covers the muscle? Yep, that's fascia. It's basically our body's own biological saran wrap. Okay, but here's where it gets really interesting. This biological saran wrap, it's not just one simple sheet. Oh no, it's a super complex, multi-layered system. And figuring out these layers, that is the first huge clue in our investigation. So, because these sheets of fascia are all layered on top of each other, they don't just form one solid block, right? Instead, they create what we call potential spaces, or planes between them. And you should think of these less like random empty gaps and more like a really specific, totally interconnected network. And this is the crucial point, really. These aren't just spaces. A better way to think of them is as a map of hidden highways. And if we want to figure out what's going on with that toothache, we have got to learn how to read this map. And here is the map itself. What you're looking at is a cross-section of the head and neck. You can actually see how these different layers of fascia wrap around, well, everything. See how they surround individual muscles and then bundle other things together? They're creating these really distinct compartments. And of course, these layers all have specific names because they have very specific jobs. For example, you've got the investing fascia, which surrounds key muscles. Then there's the carotid sheath. Think of that like a protective sleeve for the huge blood vessels and nerves going to and from your brain. And the visceral fascia?
That one wraps around our glands and organs. It's an incredibly organized system of pathways.
Okay, quick recap. We've got our victim, the tooth. We've found the secret passages, those fascial spaces. So now let's put the clues together and see exactly how this crime goes down. How does an infection actually escape? And here it is, the absolute key to this whole mystery. See, while we call them spaces, they aren't actually empty voids. Not at all. They're filled with this loose connective tissue. And why is that so important? Well, because that loose tissue is exactly what allows things to move through them, to travel.
This is the how. This is our smoking gun, right here in the source material. Pathogens can travel within the fascial planes. Just think about that. It means that bacteria from an infected tooth don't have to fight their way through tough barriers. Nope, they can just hitch a ride along these highways that are already there, waiting for them.
So if we go back to our map, we can literally trace the escape route. An infection that starts up here, near the jaw, can slip into one of these fascial spaces and just travel downwards, following the path of least resistance. It's a straight shot from your mouth, down into your neck, and maybe even into your chest, right next to your vital organ.
So what's the big takeaway here? What does all this mean? Well, this isn't just some cool, fascinating piece of anatomy. Understanding this hidden network has absolutely critical, real-world consequences for your health.
And here's the final verdict. That nagging toothache, it's never just a toothache. Because of these fascial spaces, it has a direct, protected, superhighway to the rest of your body. This is why a dental infection, any dental infection, has to be taken so seriously.
So, there you have it. We've solved the mystery of the dangerous toothache, and in the process, we've uncovered this incredible, hidden biological architecture. It kind of leaves you with one last thought, doesn't it? What other amazing invisible networks are humming away inside of you right this second, connecting everything in ways we almost never stop to think about?